Hi, everyone. Welcome to today's session. My name is Jeremy, and I'm a representative from EHN Canada. We are a nationwide network of treatment centers for addiction, trauma, and mental health. We have facilities in Nanaimo, British Columbia, Calgary, Alberta, Toronto and Peterborough, Ontario, Montreal, Quebec, and Annapolis County, Nova Scotia. We offer high-quality inpatient, outpatient, and online treatment programs. For more information, please visit our website at ehncanada.com. Just for some housekeeping, everyone is on mute and cameras are off for today's webinar, but please feel free to utilize the Q&A box at the bottom of your screen to submit questions for our speaker. We'll try to get to as many questions as we can at the end of today's session. And as always, today's session is being recorded. We will be sending out a follow-up email sometime next week that will include the link to the recording, the slides from today's presentation, and any other useful resources included in today's session, as well as your CEU certificate. So I would like to introduce to you Debra. She is the CTAP and TPIT program director in spiritual care program at Edgewood facility.
Good morning, everyone. I'd just like to say welcome to everyone for coming to this webinar today and to share this with me. First of all, I just want to thank everyone that helped me put this presentation together. I'm not very technically inclined, so I had a lot of people helping me, and I just want to say thank you to all of them. I also wanted to say thank you to all of you who are watching. I am very honored that you have taken the time out to be here and share this webinar with me. So I just want to tell you a little bit about myself. I did all of my training for my degrees in Toronto. I did my some of my degrees at McMaster University and the rest of my degrees at the University of Toronto. I studied under Bessel van der Kolk for my trauma certificates, and I continue to study under him as of today. I'm very passionate about what I do here because I have had PTSD myself, and I know a lot of people say that you cannot be healed by from PTSD, but I would like to prove them wrong because I think you can. And I think learning about my true self and the essence of who I am could not have happened without the help of some of my greatest teachers. And some of them were the courageous children. I may get emotional here. In pediatrics ICU at McMaster Hospital, facing a life-threatening illness. Some of my greatest teachers were the many people of all ages in the palliative care unit at St. Mike's Hospital in Toronto, teaching me about the most important aspects of life, which was being loved. And some of my greatest teachers were the many horses and dogs that taught me humility and power. And then some of my greatest teachers have been the many first responders, both men and women, who I have had the privilege of journeying with in our program, walking alongside them as they struggle to let go of the past, the masks, the walls, the behaviors, and the patterns that they adapted in childhood in order to survive and came to identify these as their true identity. Some of these individuals were courageous and allowed me the privilege of being a witness to their suffering. And through my own journey of healing from trauma and finding my true essence, it was one of the most difficult challenges and struggles amid the immense darkness that I was living in. Somehow I found the strength to work through my fears, to learn how to trust and to become vulnerable enough to let go of my feelings of worthlessness, shame, and self-loathing so that I could learn how to embrace my own authentic self. So that's just a little bit about me. And so what we know is that spirituality has many definitions, and for this webinar, we are using this definition of spirituality, which is we feel that spirituality is the essence of our true nature. It's who we are. It's the culture, the environment we grew up in. It's our beliefs and values, and it's our sense of self. And it helps to give motivation and meaning to our life. And I think through my own journey, I learned about my spiritual self and how nurturing it was one of the utmost important aspects of becoming whole and healed. And because of my own journey and learning the importance of spirituality and the essence of self, it is now an integral component of our program. And wisdom tells us that one cannot heal without delving deep into the core of their own inner being. And I completely agree with that. And I think that in our program, we ask these people to go very deep into themselves. And sometimes it can be a big struggle. We believe that spirituality includes one's values, beliefs, mission, awareness, subjectivity, experience, sense of purpose and direction, and a kind of striving towards something greater than oneself. And we just know that when trauma happens to people, they lose all of these aspects. So spirituality propels the search for connectedness, meaning, and purpose. And these are all the things that we believe here. It is shaped by many influences in family, community, culture, and nature. And we find that today in our society, a lot of focus is on technology and people going from A to B very quickly and people not being able to reflect and take time for themselves. Spirituality is about practices and exploration. We believe that the more they practice and explore, help them to find meaning and significance everywhere. And again, this is lost in society. Spirituality is about a journey that has the potential to enrich one's life, to help give one a stronger sense of connection with each other, as well as with life and consciousness beyond the human level. And it integrates three facets. One is healthy relationships, treating ourselves and others with respect, honesty, integrity, and love. It includes values, and also our principles, not only the things we say we care about, but also the things that cause us to behave the way we do. We also believe that spirituality helps them to find purpose in their life and to help them make choices that will have the most positive consequence. And we believe that spirituality is all about our instinctive purpose, which is something that people lose when trauma starts happening. Spirituality also includes having a zest for living and staying glued together. The zest comes from a lyrical enhancement with the world and an abiding sense of trust and peace. And we also believe that spirituality is about becoming intimate with ourselves and others and being involved in community, nature, and with the planet. So in order to enhance our spirituality, it involves a daily practice and a ritual. And some of these are practicing gratitude, because we believe that gratitude also increases the oxytocin in a person's body. Meditation is also all about mindfulness, which helps connect our brain to brain and helps people with their implicit memories. And we also believe that spirituality involves being in nature, practicing rituals, music, pilgrimage. And we know that a lot of people go on pilgrimages to find their true essence. And we believe our program is a privilege for some so that they have time to sit back and reflect and contemplate their life. So this is a quote from Thomas Merton. Thomas Merton was a mystic who lived many years ago. He had devoted his life and wrote many books on the authentic self and what that encompasses. And what he says here, which is very meaningful, and this is something that we truly believe, is that the true inner self must be drawn up like a jewel from the bottom of the sea, rescued from confusion, from indistinction, from immersion in the common, the nondescript, the trivial, the sordid, and the evanescent. And so we believe that a person's spirituality encompasses their true authenticity and an identity that they were born with. So as you can see, we believe that spirituality is a very large component of our program. So we believe and have learned and studied that one's spirituality is woven into every cell of our body. It demonstrates these expressions through our connections to others, to nature and to animals and to the world. And a lot of times people will come into this program and we ask them if they're very creative and they say no. We ask them if they're very spiritual and they say no. They feel that we're asking them about religion, but actually we're asking them all about themselves. And everyone knows that when trauma hits, people lose their motivation to work on themselves. So spirituality helps to instill in us an attitude of confidence and humility. And as many spiritual teachers have passed on, we feel that the 3 touchstones of spiritual maturity are stillness, solitude, and silence. And so those few slides are our definition of spirituality and what we believe we need to help people with. And so now we're just going to talk a little bit about our definitions of trauma. So trauma, as everyone knows, again, it has many definitions and many perspectives. There's been many people who have been studying trauma and researching it. And we follow Bessel's definitions and Gabor Mate's, Janina Fisher. And so we believe that trauma is what happens to our inner being. It causes extreme hurt and pain. It overwhelms the nervous system. It keeps the person stuck in the past. It separates them from their essence and their spirit. It is a threat to one's life. And as Gabor Mate says, trauma is not what happens to us, it's what happens inside of us because of what happens to us. And we firmly believe this because everyone that comes into our program is completely dysregulated. And trauma prevents people from living in the here and now. And we promote that a lot in our program. We help them to focus on living in the here and now. And as you can see here, we've also believed that trauma is a hurt. It's raw. As Gabor Mate says, it's like a wound and the Band-Aid keeps on coming off when we get triggered time and time again. So we're always reliving these traumatic experiences. And as Janina Fisher says, it becomes one's living legacy that keeps on giving. And as someone who has experienced trauma myself, I can honestly say that I firmly believe that we really don't know what's happening inside of us. Okay, so this is a quote from Bessel van der Kolk, and he is one of my teachers, and I still study underneath him. And he says here that traumatized people chronically feel unsafe inside their bodies, and we see this every day. The past is alive in the form of gnawing interior discomfort. Absolutely. Their bodies are constantly bombarded by visceral warning signs. And in an attempt to control these processes, they often become an expert at ignoring their gut feelings and in numbing awareness of what is played inside, and they learn to hide from themselves. And so what we see from witnessing these people is they are completely alienated from their bodies. And sometimes the word body becomes a trigger for them. And so we see this all the time. We help people recognize their symptoms are not abnormal. These are all symptoms of being hurt and having a deep loneliness and being disconnected from themselves and believing that they are worthless. So we believe that the impact of trauma on the spiritual self is very significant. It's profound. It has a devastating effect. These people, their view of their self is very damaged. There is a loss of trust and intimacy in relationships, both with themselves and others. There is a disrupted, altered system of meaning. They absolutely hate themselves. They call themselves losers, monsters. They believe they are all unlovable, and they reject anyone who tries to get close to them, including us in the beginning, because they are not used to having people be compassionate and welcoming to them. And their negative core belief controls them, and they have no idea that this is happening. And so we definitely go through one of our groups, or a couple of our groups are all about having teaching them about their negative core beliefs and having them realize that their negative core belief has run most of their life. So again, the impact of trauma on the spiritual self, their language is all consists of negativity. It's a language of despair and hopelessness. Sometimes they come in and they absolutely see no hope for the future. They're in dorsal a lot of the times, and those are the people that are very tough to treat because they're very hypo-aroused, and as everybody knows, people who are hypo-aroused, it takes a lot to get them activated. So when they come in here, we have a lot of work to do. And they all wear masks, and they all put up walls, and they all have been in a life of chaos, and they create chaos while they're here in the program. And they question the counselors, they question themselves. Their nervous system is completely unbalanced, and this is one of our main components of our program is emotional regulation. So as you can see here, there are thoughts of, I can't take this anymore and relief will only come when I die. And I would say that 99% of the people that come into our program, they have either thought about suicide or have tried to do this themselves. So we believe, and evidence has shown for years, that all the people who come into our program have developmental trauma that started at an early age and evolved into a diagnosis of PTSD in adult life. Emotional neglect and attachment are a primary cause of developmental trauma. As Bruce Perry stated almost 30 years ago, neglect has a similar effect on the brain as does trauma. In childhood, children are dependent on their caregivers for survival and safety. They are also very vulnerable to traumatization by frightened and frightening caregiving, neglect and abandonment, witnessing their parents fighting, being exposed to domestic violence, threatening words and behavior, such as "I'll kill you," or "You should never have been born," or "Why don't you just go play in the street?" Secondary effects of parental PTSD, accidents, medical crisis, surgery, invasive procedures, and death of a parent or parental figure. And all of these have devastating effects on the children. And I know there is a lot of controversy out there about developmental trauma and PTSD, but I can tell you that we have had hundreds of people come through our program, and every one of them has had developmental trauma. So these children are not attended to in a nurturing level. They were neglected, abandoned, and hurt. The missing ingredient was being nurtured with love, which is a biological need. As Bessel says, our world revolves around hate, not about love and unity. So the children perceive they are not loved. They begin to believe they have to earn love, and they start to cater to their caregivers' needs, hoping to be loved in return and have their own needs met. However, when mom is not emotionally regulated and does not have consistent nurturing behavior, she is not an effective co-regulator for the child. Therefore, the child has a chaotic connection to their caregiver and grows up in a world of chaos and stress, adapting to survival skills and not life skills. Hence, we believe that their biography becomes their biology. And we do get a lot of pushback from some of these people because a lot of them believe that their trauma is the incident that has happened either in war or with the RCMP and municipal police. They believe that it's the incident that they've gone to. Same with paramedics, firefighters, but when we actually start getting into their history and they start to share this with them, then we soon realize that, and they do too, that it started a long time ago. It could have even started in the 3rd trimester when mom was carrying them. So they grow up living in stress. They are immersed in stress hormones. And later on in life, they have a lowered threshold response to stressors. Their limbic system is kindled. It becomes very hypersensitive. And the impact of attachment and developmental trauma leads to the inner child being lost and alone, a lack of feeling safe, and a lack of ability to self-soothe. And a lot of times we see people come in and they're rubbing their legs, or they're rubbing their head, or they're rubbing their arms. And when we look into this, this started as a child, and this was a way for them to self-soothe. They hate themselves. They have a lot of rage and anger. We have a lot of people that come into our program that display their anger quite vividly, and this is good for us because then we get to help them, but they are really angry. A lot of them are in despair and hopelessness, and there's a loss of self, and they have lost their essence, their instinct of purpose. And this is just a few of what we see. They learn to adapt to behaviors and patterns that are actually a defensive cover for who they truly are. They lose their identity, and this is very sad for all of us to be witness to, actually, because their identity most of the time is their uniform. So as stated in a Harvard Journal on Childhood Development in 2012, human environments, because of scarcity or stress, untroubled young children causes children to make adaptations, which are psychological and physiological adjustments that are necessary for immediate survival and adaptation, but which may come at a long-term cost to health, behavior, and longevity. So as Pierre Genet stated many years ago, traumatized patients are repeatedly continuing the actions, or rather the attempted action, which began when the thing happened. And they exhaust themselves in these everlasting recommencements. And we definitely see this. So how do we help? Well, we do a lot of work on ourselves, believe me. As counselors here in this program, self-care is one of our main components. And we know that these people here are suffering and have immense pain and hurt. So in our program, the counselors, like I said, do a lot of self-awareness, a lot of mindfulness, and reflect in regards to their own well-being. And they have a routine to help them stay centered each day so that when we come in, we're free and clear of what happened the day before. Because I think as all of you probably know, there's a lot that goes on during the day in a trauma program. So the trauma program at Edgewood has evolved over 3.5 years, and it is based on approaching spirituality and trauma at the same time. And we believe that trauma can be a gateway to a new path of life. Some of the clients that come to our program have commented that trauma was the best thing that ever happened to them, because it forced them to reevaluate their lives and take a hard look at themselves. And a lot of the people that have come to our program, like I said, we're in hypoarousal or hyperarousal. And a lot of these people have gone on to live really great lives. They stay in touch with us, and some of them have become spokespeople for wounded warriors. Some of them go around and give speeches about the program and how they benefited from the program, and we have never asked people to do this, but this is one of our greatest rewards, is to see these people go out and live a life of potential and meaning. So we help them go into the felt sense of the trauma using modalities such as sensory motor therapy, somatic therapy, body awareness, and movement, reflection, contemplation. We teach them how to be self-compassionate, which is very tough, like I said, because this is very foreign to them. And they usually find this to be the most challenging. Their feelings of shame, anger, and fear are approached in a very compassionate and loving manner, because we all know until the person feels safe, they will not allow themselves to relax and let down their walls, take off their masks, and allow us to guide them to discover and explore the essence of their being. And this takes a long time. Like, our program is divided into 3 phases. And the first phase is safety and stabilization. And that is one of the toughest phases that we go through, because these people are not used to regulating themselves. They're used to being totally dysregulated, and they fidget, and they have to have something in their hands at all times. And they have no idea what a coping skill is. And so, you know, to have them learn how to trust somebody and to get vulnerable with us is a big feat in itself. So We try to help them surrender to the pain and the suffering and to trust us and know that we are here to help them live a good life. And so along with these groups in our program, we help them to understand their triggers, which is a big part of it, their implicit memories, and their procedure learning. In our program, we also do accelerated resolution therapy for exposure, and we believe in that quite a bit. So part of our program as well is explaining how the amygdala functions and how they have become dysregulated and hypersensitive to the world. We teach them that practicing mindfulness will engage the medial prefrontal cortex, which in turn has a reciprocal relationship with the amygdala, where a lot of these memories are that are nonverbal. So rather than reacting to their traumatic triggers with impulsive reactive behaviors, they will be able to take a moment, notice what is happening to them, and have the ability to stay in the present moment. We believe that the more they learn about this, the more they will be able to help themselves and take this with them when they leave here. So a lot of times we will make a graph for them. We have somebody in our program right now that has immense anger, and when he gets angry, he reacts very quickly, and this has been very traumatizing for him as for his family. So I have made him a graph on his procedural learning, his implicit memories, his triggers, and, you know, how it elevates his nervous system, and then what he's to do in order to change this. And he's been working on this for about 2 weeks now, and it is really helping him. So in our approach is one of compassionate curiosity, helping them to learn how to be co-regulators, to socially engage, to live in ventral, and to trust their fellow peers. We incorporate mindfulness both directly and indirectly into our programs. We feel that by doing this, that this is a way for them to learn how to suffer into truth. And trauma can either lead somebody into truth, or it can lead somebody away from truth. It can block it. So we believe there is wisdom in the disconnection that happened a long time ago, because it was unbearable to be connected when the person was in not being supported and in a threat zone. And when trauma happens, we lose the essence of who we are. This creates a missing piece, and as Gabor Mate states, we try to fill it up with compensating mechanisms called personalities. Sorry, I haven't had my coffee yet. And what we know is that researchers tell us that a lot of organizations take the spiritual out of trauma and medicalize it. And I guess that's something that I have a passion for, because I think that it's very easy to give somebody a pill if they come into the doctor's office and they're complaining about anxiety or depression, or, you know, they can't sit inside their own skin. And we all know that in society today that there is not a lot of time for people to sit with people, and this is unfortunate because this is what these people need. We have spoken to many of them on a very intimate level, and they have told us some of their experiences with the medical system before they came into our program. And it's really sad to hear and to witness, because these people need all kinds of help. And so spirituality, like I said, is not widely accepted in the medical field, where they separate the mind from the body. And healing from trauma can only happen when compassion is present. And so a person's sense of self expands beyond the little personality, and there is more to us than physical and psychological boundaries. And we feel that the 4 virtues of spirituality are hope, gratitude, forgiveness, and compassion. And so when these people come in and they're very, you know, they're suffering on a deep, deep level, we try to reach them on a deep, deep level. So we try to help them shed the veil of the inauthentic self, to embrace the self that has been longing to meet them. We help them to understand they can't change the past, but they can definitely change their relationship to the past. So we consider our program to be a journey, and we tell people this when they come in, and we tell them that now that they're on the spiritual journey, it's going to be a lot of hard work. They may not want to do the hard work, but the hard work is worth it. And we have a lot of alumni that have actually helped some of these people come into treatment. We have a lot of alumni that are out there waiting to help these people after they leave the program. And so we are very, very lucky that way. And we thank these alumni each and every day for being a big part of our program, because they are still on the journey and they're out there helping other people. And we all know that this can be a domino effect. So we help them with their patterns and behaviors. We help them learn that they are very resilient. We help them learn that their patterns and behaviors have been so ingrained in their psyche that they and others believe this has been their true self. And these patterns leave deep impressions that form a consciousness that gets misinterpreted as the true self. And then they believe that this is their identity. And like I said, most times when they come in, they believe that their uniform is their identity. And even though they don't wear their uniform here in treatment, they still have their uniform on, and they talk from a RCMP perspective, or a firefighter perspective, or a military perspective. So, you know, in order to help them take that uniform off, it can be very scary for them, and because then they're going to be vulnerable with us, and to be vulnerable, according to them, is a sign of weakness. And so this is where, again, the counselor has to be very aware of who they are, and their mindfulness and their self-awareness, in order to approach each person on an individual basis. So every person in our program is not treated the same. All the treatment programs are individually assessed and made out for them. And so we believe that the ego, even though it's helpful to have an ego and it develops in the first few years of life, that the deep suffering forms very deep impressions in their consciousness and can only be reached by using compassion, mindfulness, and having a therapist who is very aware who they are and have walked through their own trauma and the dark night of the soul. And I know that there are a lot of treatment centers that are using different types of drugs and things like that in order to get to the deepest core of the person. But we firmly believe that we can do this by using spirituality and helping them learn how to reflect and contemplate. So everything we do here is very personable. We get to know these people on a very, very deep level. I can tell you, when they come into treatment, most of the times they don't want to be here. They can't stand us. They don't like us. And when they leave, they are crying because they really just want to stay. And we cry ourselves because we get to know these people on a very, very deep level. And we take this very seriously. So we have a lot of gratitude for these people and the people who send them here. So why are the horses in these slides? Well, it's like I said at the beginning, horses and dogs have been a big part of my journey. Sorry. I just lost my dog. And these animals teach us to have so much humility and to go through the world with grace. And that's what we try to do here. So As you can see, this program is very passionate for me. I have developed this program 3.5 years ago, and we just, all of us who work here, we love each other and we love the people who come here. And some of the patients knew I was doing this webinar today. They all wanted to watch it. Anyways, we just believe that compassion is one of the strongest attributes to help a person become vulnerable and find their true identity and to go out there and live with an instinct of purpose. So I just want to say thank you to everyone who listened. I know there's some people out there who I talk to who have referred patients to us, and I just want to thank you very much for spending the time to listen to me. I hope it was informative, and I think Jeremy is available if you have any questions.
Thank you so much, Deborah. And lots of comments in our chat box giving their condolences for your loss and appreciating your vulnerability. So thank you so much for being so open and honest.
Oh, you're welcome.
And yes, lots of questions, as you mentioned. So we will get right into those. So first question is, what are some ways in which spirituality, religion, or faith help someone cope with personal trauma?
Well, I think first of all, we separate spirituality from religion, and so we don't want to get into the politics of, religion and all the aspects of that. So we delve deep into spirituality, and we consider spirituality to be all about them. So we help them find their truths that they stand convicted in, their desires, their passions, what they want to do in life, what are their desires, what's inside of them. And first of all, we need to help them answer the question, who am I?
For sure. And then another question is mentioning that I might have missed it at the beginning, but which location are trauma programs available at? And is there an online option? So I can answer that too, just saying that we do have trauma programs available across our EHN network, as well as virtual options too. But I don't know if Deborah, you want to expand on that.
Yeah, like our trauma programs are offered across Canada. I'm not sure about the other programs and what they offer. Yeah, I'm not sure.
There's a lot of information about our trauma-specific programming too on our website. So feel free to visit ehncanada.com and you can get in contact with somebody if need be as well. And then the next question. How do you help people safely engage in meditation and mindfulness when they do not feel safe in their body?
That's a good question. First of all, we have to help them regulate and learn how to emotionally regulate and breathe with them for sure. I forgot to mention that we do have one of our groups here is sound therapy, and sound therapy is all about helping the muscles behind the ears form properly, which weren't formed when they were a child and had developmental trauma. So that is one of the ways we do that. We offer MP3 players with lots of meditation on them to each patient as they come in. And so we gradually have them listen to that and learn how to regulate. I mean, regulate is a big component of our program. And so that is one of the first things we do.
Great, thank you. And now a little bit of a personal touch with a follow-up question as well. Deborah, what an amazing topic and excellent presentation. I am right now realizing the trauma I experienced with a mom who was clinically paranoid. There's a lot for me to unpack, but I'm wondering what types of resources you have found helpful for you.
Okay, is this question specifically in relation to her relationship with her mom, or?
It's just saying now realizing the trauma that they had experienced with a mom. It doesn't say their mom, it's just saying a mom in general. So I think maybe just resources that would speak to paranoia.
Okay. Well, one of the books for sure is Bessel van der Kolk's The Body Keeps the Score. Any book by Yanina Fisher would be great. Pat Ogden, Peter Levine, Dan Siegel, any of those authors write books about mental illnesses, and I think that there would be a lot of information in any one of those books. We have all of those books here in our library, so I know that they're very informative. And as for spirituality, I think one of the best books that is an entry-level book for somebody to read would be Dan Millman's The Peaceful Warrior, and then The Sacred Journey of the Peaceful Warrior. Those are two books that are incorporated into our program, and they're all about mindfulness and staying committed to myself and practicing living in the here and now.
Thank you for those resources. And then we have a question. Why is surrendering to the pain and suffering necessary to help people cope with trauma?
Because it's the pain and the hurt that has caused all of this suffering, and sometimes they don't realize it. Like a lot of times when they come in and we sit with them and we ask them how their childhood was, they say great. And then when we start delving into it, we realize that there's been a lot of abuse, both psychically, mentally, physically with parents, and a lot of neglect. And so we help them realize that. We help them to get open. Can you just repeat that, Jeremy? Sorry.
Yeah, of course.
What was the question?
Sorry, I'm just going to grab that for you right now.
Sorry, I've got so many
Nope,
things on my mind.
that's okay. I'm just trying to locate it myself, but we're getting there. There we go. Why is surrendering to the pain and suffering necessary to help people cope with trauma?
Oh, okay. Yeah, so we have to get them to accept that they have a lot of pain and suffering so that we can help them get vulnerable and talk about it, and help them realize that their body is in control of them. And so we really work hard on the body to help them realize their felt sense, and that this is a big part of their pain and their suffering. You know, we help them realize that everybody that comes into the program has a lot of suffering and pain. And I mean, I think it helps when I tell them that I have suffered with PTSD. And so, you know, surrendering to it is a big thing. And another word for surrender is being congruent and acceptance. And so when we change the word suffering to acceptance and congruency with them, then that becomes a little easier for them to accept. And also, you know, our program, the way it's situated in our facility here, we're in a very safe environment. We make it that way. It's very quiet here and very welcoming. And so, you know, just coming in here and accepting that they're here, that's a big part of it as well.
Absolutely. And there were a couple of comments in the chat box about creating a safe space. So you touched upon that. And then our next question, which I believe you touched upon, I don't know if you want to expand on, but with that answer, what does it mean to surrender to the pain and suffering? I think you kind of highlighted it when you're.
Yeah, well, I think a big part of it, I guess I'll talk about myself, if that's okay. You know, like, if I can do this, you know, a lot of my trauma came from living in a household where my parents both drank, and they both drank themselves to death when I was very young. And I have a brother who committed suicide when he was very young because he was a drug addict. So I was suffering immensely and in a lot of hurt and pain. And I just hated the world, and I hated everybody. And I didn't know where to turn to, and that's when I turned to my horses and my dogs, and because I'm a rodeo rider. And finally, I had to accept the fact that if I didn't accept that I was suffering and that I was in a lot of pain, there was no way I could get help, and I had to I had to find a way to do that. And that was one of the biggest struggles for me, was to accept the fact that I was suffering. And because I didn't want to be vulnerable. I'm a very self-reliant person. And to be vulnerable to somebody when I didn't know how to trust anybody was very difficult. So I think it's very important for people to realize that we all have pain and suffering.
Thank you, Deborah. And I'm going to echo the comments that are coming in right now for the gratitude towards your transparency and your openness about your journey. So thank you for sharing.
You're welcome.
And then moving on, what are the main ingredients for being trauma informed?
That's a good question. I think the main ingredients for being trauma informed is to be very self-aware of yourself, and to practice mindfulness, and to realize that we all have an impact on other people. And even if we walk into a room and we don't say anything, our presence can affect many people. And so our presence is one of the biggest assets that we have. And I guess I learned about that when I was a chaplain in pediatrics ICU at McMaster, working with little children that were dying and their parents were there. You know, I soon realized that the way I presented myself and how I walked into a room was going to have a big effect on them. As well as working in palliative care, you know, a lot of times we just want to rush in there and help people, but what we need to realize is the language we use and the way we conduct ourselves has a big impact. So I think one of the first things is to be very mindful of who you are and your language, and to learn how to ground yourself and to stay grounded, and to realize that you need to live in the present time and not in the past. Because when someone is very dysregulated and they're looking to you for help, the best thing that you can do is just sit and be present with them.
Absolutely. Thank you. And then there's a question more to like logistics of our programming. So is the program covered by extended medical, or is it a self-pay?
Our program is, a lot of people are self-payers. I think that if you have extended medical, you may get reimbursed for the program here. A lot of people that come here are referred from, you know, like the military, the RCMP, all the different firefighters, departments and detachments all over the place, paramedics. So most of those people are referred, but right now we do have some people in treatment that are self-paying.
Thank you. And then there are a couple questions. This one I'll field because it's more about the follow-up email. So you will be receiving a CEU certificate to your emails that you have signed up with, as well as a copy of the recording and today's presentation. And I'm going to ask Debra after for some additional resources too that will be included in the follow-up. So put your mind at ease for that for sure. And then how does this work with individuals that are atheist and or secular? Have you had success with these individuals?
Can you repeat that question?
Of course. So how does this work with individuals that are atheist and or secular? Have you had success with these individuals?
Yeah, you know, it's that's a very good question. And like I said, when people come in here, we are not a religious-based program. We are spiritual based. And so a lot of people who come in here who call themselves atheists are atheists in regards to religion and, you know, all the things that a lot of religious denominations have used in the past, both with war and things like that. So We don't talk about religion here, and if they want to be an atheist, that's fine with us because we're here to nourish their spirituality.
Absolutely.
Yeah, and they complete the program, so doing well. I mean, there's a lot of them that come in here that are like that.
Perfect. Thank you. And then it looks like we have time for one more question. Just gonna get the question, sorry. This is more, I think, just like an opinion question maybe, and then you can speak to your experience as well. But why isn't public funding available for such an essential service?
Why isn't public funding available?
Correct.
Well, that's a good question. That's a question I ask myself all the time. I don't know if it's politically correct for me to say that I'm not a big fan of how society is working at the moment. I think that there is a large focus on technology, and granted, we need technology, but I think we have forgot the humanness of each other in that process. And I think that we have forgotten about what makes us human and helps us connect to each other. And so, you know, that's a huge question, and I don't know the answer to that. I mean, I wish we could help everybody. Believe you me, if I had my way, people would be here without having to pay anything because I want to help as many people as I can. Yeah, it's unfortunate that society is that way.
Yeah, absolutely. Well, Deborah, I would like to thank you so much for today's presentation. I'm going to echo the comments as well. Thanking you for being so informative, transparent, and relatable with your content, and just overall making sure that everything is being relayed in such a respectful manner. So thank you so much again for today's presentation.
Thank you, Jeremy. Thank you, everyone. Thank you very much for being here and listening to me. I was a little nervous when I started, but I just want to thank Jeremy and Suen for inviting me to do this, and for all of you to be listening and watching it. I have a lot of gratitude and appreciation to all of you. So thank you very much.
Of course, we're happy to have you. And for everyone attending today's webinar, thank you so much for attending today's webinar. We will be sending out a follow-up email sometime next week, mid to late next week. That will include a copy of the presentation recording, the PowerPoint slides, as well as your CEU certificate. Hope to see you at future webinars. Take care.